And joining me now is Dr. Seth Berkley. He's part of an international umbrella group known as COVAX, which is working to speed up the development, production, and access to COVID tests, treatments, and vaccines throughout the world, particularly those countries with less means than the industrialized world. Dr. Berkley, welcome to Meet the Press. And I want to start with paint a picture. You know, in some ways, America's in its own bubble with its vaccine supply, while you are trying to figure out how to vaccinate the world. How dire would you paint the situation right now globally?
Well, certainly I won't be as positive as Tony Fauci was. And just to start and put this into perspective, this is a global pandemic. It started in a point outbreak in China, and it very rapidly spread around the world. And I think the challenge we started with is to remind people that you're only safe if everyone's safe, because viruses will mutate and they'll continue to move, and that's what we've seen. I think initially people were not taking that seriously, and we saw a lot of vaccine nationalism. We saw high coverage in a small number of countries, 75% of the vaccine being used in 8 or 9 countries. And we now see, if you look at high-income countries, about 40% of the populations are vaccinated. But in low-income countries, it's still less than 1%. And I think when India, the variant that came out of India, the Delta variant occurred, I think people woke up and said, yes, this is true, because that went to 40 countries and now to 85 countries. And we have to keep in mind that this may not be the last variant. So what we need is a global process, and we're not really there yet in terms of getting the coverage we need.
Explain some of the hurdles, okay? I mean, basically you need 9 billion vaccines minus the billion. Let's say you need 8 billion people to be vaccinated. What are the biggest hurdles standing in that way?
Well, I mean, there's many. So first of all, as you know, when we started this whole effort, we had no idea whether any of these vaccines would work or if all of them did. And we were very lucky. We had fabulous science. First vaccine, 327 days. That's amazing. The previous record before that was 4 years. So I think to keep in mind how fast the science moved. But we normally provide, in terms of vaccines, about 5 million doses a year. And so now what we're talking about is quadrupling that number, because the number you mentioned is people, but of course most of the vaccines are 2 doses. So we need double the number of vaccines to cover that population. So this has been a unprecedented, in a sense, drive towards that. And we've been very proud to see the increased supply. Of course, we've hit all kinds of problems. The biggest problem we hit was as the outbreak occurred in India, which is the largest producer of vaccines by volume. It meant that they turned national with their programs, and that meant that there were less for the rest of the world. But of course, at the beginning, had vaccines been shared, we would have been able to get to healthcare workers and high-risk groups quickly, and that might have dampened the spread of the infection. We ultimately, of course, need to get there.
All right, I'm curious, how do you handle, you're getting vaccine contributions from China, you're getting vaccine contributions from the United States, you're getting vaccine contributions, I think, also from Russia, and just among those that develop their own vaccines. The Chinese vaccine is seen as not quite as effective as some of these, the Moderna or the Pfizer vaccine. How do you deal with that as an international organization? Certainly, that vaccine is better than nothing for some people, but some vaccines are better. How do you equitably handle that situation?
Well, first of all, as I said, we had no idea whether vaccines were going to work when it started. But as vaccines began to show promise, our requirement is that vaccines go through a stringent regulatory agency, that they show high levels of efficacy, that they show safety, and we require WHO pre-qualification as a standardized way to look at vaccines across the world. At the moment, we're not using the Russian vaccine and Chinese vaccine. That may change over time, but we are using a range of vaccines. We have 9 vaccines in our portfolio now, soon to be 11 or 12, and that's what we started as a priority to move forward, because we realized we very well might have needed a diversity if it turned out that different types of vaccines didn't work. Of course, we've been lucky. Now, the advantage of this, it's not only that we did this. For example, the U.S. government as part of Operation Warp Speed, invested in a range of technologies. It turns out that the mRNAs worked very well, that Johnson & Johnson you've already talked about. And so what now is happening is there are excess doses that have been produced by most of the high-income countries. Our estimates are somewhere between 1.5 billion to 2 billion doses. Those can supplement the doses that we've purchased. We've purchased about 3.4 billion doses of vaccine, but if those countries are willing to make those vaccines available now, we can move those forward. And for example, the U.S. Did its first donation with us to Honduras last weekend.
Dr. Seth Berkley, good luck with this. Obviously, none of us can get out of this pandemic until the world gets out of this pandemic. Really appreciate you coming on and sharing your perspective with us.
Thank you, Chuck, for having me.
Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.